Blood pressure is one of the most important vital signs in medicine, yet it is also one of the most misunderstood. Every day, patients are told a pair of numbers, often without a clear explanation of what those numbers truly mean or which one should concern them most. Many people assume the top number is all that matters, while others believe the bottom number is the key indicator of danger. The reality is more nuanced. Both systolic and diastolic blood pressure carry clinical significance, and the risk they represent depends on age, vascular health, and long-term patterns rather than a single reading. Blood pressure reflects the force exerted by circulating blood against the walls of the arteries. This pressure is necessary to deliver oxygen and nutrients to tissues throughout the body, but when it remains elevated over time, it damages blood vessels and organs. The heart must work harder, arteries become stiff and narrow, and the risk of cardiovascular events increases substantially. For this reason, blood pressure is often referred to as a silent threat, because damage may occur for years before symptoms appear. The systolic pressure, which is the top number in a blood pressure reading, represents the force within the arteries when the heart contracts and pumps blood forward. This is the moment of highest pressure in the cardiovascular cycle. Clinically, systolic pressure has been shown to be a particularly strong predictor of heart attack, stroke, and heart failure, especially in middle-aged and older adults. As arteries age, they gradually lose elasticity. When this happens, systolic pressure rises because stiff arteries cannot expand to absorb the force of each heartbeat. In adults over the age of 50, elevated systolic pressure is often the most dangerous component of high blood pressure. Many patients present with readings in which the systolic number is high, while the diastolic number remains in the normal range. This condition, known as isolated systolic hypertension, is not benign. It significantly increases the risk of stroke, aortic aneurysm, kidney disease, and cognitive decline. A systolic pressure consistently above 140 millimeters of mercury should always be taken seriously, regardless of what the lower number shows. Diastolic pressure, the bottom number, measures the pressure in the arteries when the heart relaxes between beats. This phase is critical because it is when the heart muscle itself receives blood flow through the coronary arteries. Diastolic pressure reflects the baseline resistance within the arterial system. When diastolic pressure is elevated, it indicates that the arteries remain under excessive tension even at rest. Over time, this constant pressure can damage the inner lining of blood vessels and contribute to heart disease. In younger adults, particularly those under 50, diastolic pressure may be a more relevant indicator of long-term cardiovascular risk. Elevated diastolic pressure in this age group is often associated with increased vascular resistance and early arterial dysfunction. A diastolic reading persistently above 90 millimeters of mercury is considered abnormal and should prompt evaluation and management. Even when systolic pressure appears only mildly elevated, a high diastolic number should not be ignored. The most dangerous situation occurs when both systolic and diastolic pressures are elevated. In this scenario, the cardiovascular system is exposed to continuous strain throughout the entire cardiac cycle. The heart must pump against increased resistance, and blood vessels are subjected to constant mechanical stress. This significantly accelerates damage to the heart, brain, kidneys, eyes, and peripheral circulation. Patients with combined systolic and diastolic hypertension face the highest risk of heart attack, stroke, and organ failure if blood pressure is not controlled. It is important to understand that blood pressure should not be judged based on a single measurement. Readings can fluctuate due to stress, physical activity, caffeine intake, dehydration, or emotional state. What matters most is the pattern over time. Consistently elevated readings, even if only mildly high, are far more concerning than an occasional spike. This is why regular monitoring and proper measurement technique are essential for accurate assessment. Another commonly overlooked issue is low diastolic pressure, particularly in older adults. While lowering blood pressure reduces cardiovascular risk, diastolic pressure that falls too low can impair coronary blood flow. When diastolic pressure drops below approximately 60 millimeters of mercury, some individuals may experience dizziness, fatigue, or an increased risk of falls. In certain patients, excessively low diastolic pressure may also reduce oxygen delivery to the heart muscle. Therefore, blood pressure treatment must be individualized rather than aggressively lowered without consideration of symptoms and overall health. Blood pressure thresholds exist to guide clinical decision-making. A systolic pressure below 120 and a diastolic pressure below 80 are considered optimal for most adults. Readings consistently above 130/80 indicate hypertension and warrant lifestyle modification, medical evaluation, or both. Systolic readings above 180 or diastolic readings above 120 constitute a medical emergency and require immediate attention. These levels can precipitate acute events such as stroke or heart failure. One of the reasons high blood pressure is so dangerous is that it rarely causes noticeable symptoms until significant damage has occurred. Many patients feel completely well despite having dangerously elevated readings. This absence of symptoms often leads to delayed diagnosis and treatment. By the time complications develop, such as chest pain, shortness of breath, or neurological deficits, the underlying disease may already be advanced. The causes of high blood pressure are multifactorial. Genetics play a role, but lifestyle factors are equally influential. Excess sodium intake, poor diet quality, obesity, physical inactivity, chronic stress, inadequate sleep, smoking, and excessive alcohol consumption all contribute to sustained elevation in blood pressure. Chronic inflammation and insulin resistance also play important roles by impairing blood vessel function and increasing arterial stiffness. The encouraging reality is that blood pressure is highly responsive to intervention. Modest lifestyle changes can lead to meaningful improvements. Weight loss, regular physical activity, improved sleep, stress reduction, and dietary adjustments can lower both systolic and diastolic pressure. In many cases, these changes reduce the need for medication or enhance the effectiveness of prescribed treatments. When medication is necessary, it is used to protect organs and reduce long-term risk, not merely to achieve a numerical target. When patients ask which blood pressure number is more dangerous, the most accurate answer is that the greater risk comes from whichever number is abnormal for their age and health profile. Systolic pressure tends to be more predictive of events in older adults, while diastolic pressure carries greater significance in younger individuals. However, neither number should be viewed in isolation. Together, they provide a complete picture of cardiovascular strain and vascular health. In clinical practice, blood pressure is not simply a set of numbers. It is a window into the health of the cardiovascular system. Persistent elevation signals that the heart and blood vessels are under stress and that intervention is necessary to prevent future complications. Early recognition, consistent monitoring, and appropriate management can dramatically reduce the risk of heart attack, stroke, kidney disease, and premature death. In conclusion, both systolic and diastolic blood pressure matter. Neither should be ignored, and neither tells the full story on its own. Understanding what these numbers represent empowers individuals to take control of their health before irreversible damage occurs. Blood pressure management is not about fear or perfection. It is about prevention, balance, and long-term protection of the heart and brain. Proper awareness and timely action can make the difference between healthy aging and preventable disease.